Welcome back, everybody. Dr. Mark Vogel is with me for the next few moments. He's an orthopedic surgeon in the Southwest Georgia area, and a lot of people will put off having any kind of back surgery and just live with the pain and pop pills till they can't stand it anymore because they simply dread, I guess, going under the knife. It's good to see you here. Thanks for being on this Tuesday. First of all, when a patient gets to the point where they just cannot stand it any longer, then they'll call because they need something done quickly. But when they have severe pain in the back, does it always mean that there is something terribly wrong or not? How serious can that be?
Well, it actually sort of depends on what's going on. I have a little model here that I brought just to show some anatomy, because when people come in, I don't really know what kind of understanding they have of the things that go wrong. You know, this is a model of the spine, and the discs are the cushions in between, and everyone's heard of a herniated disc, which is like a jelly donut cushion in between. And there's nerves that come out at each level. So there's really two kinds of pain that are the most common in degenerative conditions. One is where the disc goes bad, it's a bad cushion, and the other is where nerves get squeezed. Now, unless someone is getting paralyzed and getting muscle weakness or losing bowel or bladder control, they never have to have anything that I have on my menu of options to offer them. It really comes down to like when your grandmother gets a hip replacement, she decides when it's time, not the doctor. So everyone has their own threshold or their own line in the sand of when it's bad enough to have something done. But there are a lot of non-operative things like exercise, medicines, sometimes injections that can help.
When there's severe back pain, leg pain, at what point will you consider MRI, and how much can that show you, or will it show you as a physician?
Well, MRI is an important diagnostic tool, and it helps us to see the soft tissues, because an X-ray sees the hard tissues or the bones, but if there's a bulging disc, then it may not show on an X-ray. So the spinal canal is where all the nerves come down from the spinal cord, from the brain, and the holes where the nerves come out at each level is called the foramen. And if any of those levels have nerve impingement or not enough room for the nerves, that's something that would show up on an MRI. So it depends. It really comes down to how bad the patient wants to go to the next step.
Herniated disc versus ruptured disc, is it the same or completely, are we talking about two different things here?
It's a little bit like Kleenex and tissues. Think of a jelly donut as the model for the disc or the cushion in between. Technically, a herniated disc would be like if the jelly squirted out through the dough. Maybe a prolapsed or protruding disc would be like the dough bulging. Either way, it's not a competent cushion, and it's becoming too big, and it's putting pressure on nerves.
If you have a herniated disc, is surgery the only option or one of many?
Well, it's one of many. There's about a 90% chance that with non-operative treatment, by 6 weeks, the patient will recover completely, even if they have some muscle weakness like a foot drop. In most cases, though, it really winds up being up to the patient. I think I'm a little more likely to recommend surgery if they have muscle weakness, because that's at least partial paralysis, and it may not come back unless you get the pressure off the nerve.
Yeah, when you talk about conservative treatment for the patient, it may seem like extremely liberal techniques and treatments maybe to that patient, but to the physician it's still conservative. How do you define that to a patient when you're trying to explain to somebody exactly what you need to do to give them some relief or some comfort?
Well, to me, conservative means non-operative. It means no invasion into the person's body, and whether that's done with medications or exercises, that's really what I consider most of the conservative treatments. But things like injections can be fairly safe and also can give the patient a lot of relief. I think the next step beyond conservative is surgical.
And when you talk about surgery, the question is asked, when do you decide to do that? If the patient is medically ready for the surgery, we're going to talk about a couple of those after the break. So Dr. Waldron will keep his seat. He's an orthopedic surgeon as we continue to talk about back problems. Back in just a moment.